Hi, everybody. Dr. Terry Fossum, and it is my pleasure to be here with what I think is the best veterinary dentist in the world. So this is Dr. Kipp Wingo, and Kipp graduated from veterinary school at Texas A&M, where I spent time on the faculty in 1990. And then he went on later to do a specialty in dentistry. So I'm going to let him tell you about that. Because I'm guessing that many of you probably don't even know that we have veterinary dentists that can do things like root canals in dogs. In fact, Dr. Wingo did a root canal in one of my dogs. So, yep, it's a pleasure to have you here.
Well, it's
Thank
a pleasure to be here. And I must say, Dr. Fossum is not only my hero, but anybody that does any kind of surgery. We go to the book, Dr. Fossum's surgery book, and we look it up. So she's definitely well respected in our industry. So let me tell you a little bit about what I am and how we get here. In human dentistry and oral surgery, there are typically two people. There is a dentist, and the dentist may fill your cavities, clean your teeth, maybe put braces on you. Then there is an oral surgeon. Typically, they're two different people. So a dentist may have that degree called a DDS, a Doctor of Dental Surgery. And a oral surgeon is most of the time a DDS and a MD. Not all the time, but most of the time. Then they do this big long residency. So in the veterinary field, we do this big gnarly residency to specialize. Typically, we're a veterinary first. We required to have so much experience before we do our residency. I had a lot of experience before I did my residency. I'm a late bloomer. And I've been in many fields of veterinary medicine, and I like every time when I was doing a lot of horse work, I loved horses. I did cow work, I love cows. Now I really do love dentistry. It is my passion. I live for it. So anyway, in our world, we are dentists and oral surgeons. So if you look at my caseload, about 50% of my caseload is dentistry. It is filling caries, cavities. We don't see many of those. Is anything you can imagine to do with a tooth, we do. The other half of our practice, or anybody like me's practice, typically is oral surgery. Oral surgery is roughly half trauma. My record year is 2020. COVID year, believe it or not, I had 150 fractures that I worked on, or trauma cases. The other half of oral surgery is cancer. I see a lot of dogs with cancer, and we try to remove that and help them, and we do in a lot of cases. There's not many people like me in the world. Normal people don't like teeth. I get that. But normal's boring. So none of us are boring. We really enjoy what we do. There's about roughly 216 of us in North America. There's maybe 40 or 50 in Europe. They're behind us a little bit, but they're catching up very rapidly. And one of the things, I think I'm going to speak for most of my colleagues, one of the things that pushes us towards this is when we're in general practice and we learn a little bit of dentistry, we work on these patients, and on recheck, our clients are telling us, "Oh my gosh, thank you. My cat's zooming again. My dog's more active. They feel so much better." Well, everybody likes to be pat on the back, so that fuels that thirst for more knowledge, and then we get more knowledge, and we hear that again and again, and it's what we live for. I mean, our whole life, our professional life, centers around making these animals better, and there's no better way to do it. So, anyway, that's what we are.
That's awesome. So how long was your dental program? So after 4 years of veterinary school, and then you were in practice, and then when you went back, how many years?
Well, you can't really use me as an example because I was older and I'm obsessive about what I do. So I did it very quickly. I actually hold the record. The average time from start to finish is roughly about 4 years. We're one of two specialties in veterinary medicine that has a pretty grueling practical test. And the pass rate on first you do a written and then you do a practical. Pass rate is roughly about a third. In some years it may be a half, but it's pretty tricky. So it takes people a while to get through that. Um, it's very intensive. I don't know. It's no more intensive than what I did in the past. At one time, I had 3 practices in Texas, and we worked pretty much 24/7. I think maybe my residency was less work than that. Um, so yeah, it's roughly on average about 4 years. I think the required supervised time is 30 months, but then you have to publish a couple papers. You have to have contact hours with other specialties, and so many of these hoops you jump through that just take additional time.
Yeah.
And then the test is just killer. A lot of times, the rate limiting step is getting your articles published.
Yeah. So 4 years of vet school, 4 years of specialty training, just to be clear.
Yes, ma'am.
Okay. So tell us about dental disease in dogs and cats. Why should we care?
Because it's there. It is documented that 80% of dogs over 2 years old will have some form of a dental disease. It hurts them. Cats, for example. So there was a study out of Europe. 80% of cats over 9 years old had a lesion called tooth resorption. Tooth resorption is horribly painful for these cats. Case in point, my daughter's kitty cat got her teeth cleaned. His name is Choya. And my daughter loves that cat. She's allergic to it. And I said, do you still want to sleep with your cats? He said, well, yeah, I'll just have to sneeze. So that's how much she loves her cat. So I had 2 resorptive lesions on 2 little bitty teeth. And one of our specialists, Dr. Schomburger, worked on this kitty cat. And then 2 weeks later, unsolicited, said, what in the heck did y'all do to Choya? He's zooming. He's happy. He's running back and forth. And he's just a whole different cat. So it is very, very common. So the basic problem in our animals is they don't have these. They don't have opposable thumbs, and nor do they have the will to brush their teeth twice a day or floss, right? So let's put this in perspective about the commonality of dental disease in animals. I brush my teeth twice a day. I floss once a day, and I even do a water. So I go to my dentist every 6 months. And every 6 months, he finds some pathology in there to charge me extra. So if I take that care of my teeth, think about your doggy that may be aging 5 to 1, 7 to 1 to you, and you don't brush your teeth for that long. So, yeah, it's a big deal. Some of these patients we treat, breeds that I love, I do, like Yorkshire Terriers. I mean, they're just such good dogs. Wouldn't mind having one, but they're the poster child for bad teeth. I'm going to say nearly 100% of them are going to have trouble with that. And we could probably change that maybe with some selective breeding in the future. But that's
Okay, so gosh, 80% of dogs have some type of dental disease. Talk to us about, okay, so dogs don't have opposable thumbs, they can't brush their own teeth, but their owners should be brushing their teeth, right?
Yes, they should.
Okay, so talk to us about what that means. How many times a day? How do they do it? What kind of toothbrushes? What kind of toothpaste should they use?
So we'll address that. Then I also want to address, if you'll remind me, strategic teeth. Okay. The gold standard for home care is brushing dogs or even cats' teeth. It is the gold. Nothing is as good as that. And if you guys can see, if brushing teeth is that good, everything else is about that good. Okay. So there are limitations to brushing teeth. If you brush any less than every other day, it's a waste of time. You might as well pour water in your ear. You're not doing any good. Best is twice a day. It doesn't have much. We're all busy people. Really, really good is once a day. And when I'm trying to convince my clients to brush their pet's teeth, I'll compromise. I says, give me 2 minutes every Monday, Wednesday, and Friday. And I'll get some takers on that. Those patients or those animals that their parents are brushing their teeth, and I see every 6 to 12 months, I'm just really checking things out. I mean, those guys are most unless they break a tooth or something, they're pretty darn healthy. The most important part of brushing teeth in animals are the mechanical action of the bristle. Okay, you don't even have to have toothpaste. This is the same with people. It's the mechanical action of the bristles that are breaking down a film of bacteria in our mouth we refer to as plaque, and it's really easy to break down. Now, I like, for myself, toothpaste. It makes my mouth smell fresh and feel fresh. The dogs and cats will use a flavored toothpaste. It has good stuff in it. It does. It's helpful. Okay, but remember, the most important action is the mechanical actions of the bristles. But most importantly, because it's flavored, a lot of animals are like me. They're food motivated, right? So they get a taste of that, and it's fun. It becomes a treat. And in animals, I don't think I've ever met one that wasn't a creature of habit. If you brush their teeth every day at 6 o'clock, they're coming to you want their teeth brushed. So the toothpaste, it doesn't matter. What matters more is what your pet, your dog or your cat enjoys um, to do. Now, the dogs, they can't gargle and spit, right? I've tried to train them to, and I'm not smart enough to do that. It just doesn't work. So when you brush their teeth, they're going to make licking and chewing actions, and they swallow the toothpaste. So the toothpaste we use on animals, dogs and cats, not human animals, it is digestible and it doesn't hurt them. If you use human toothpaste in them, you're gonna make them sick. So never do that. Okay, just use the stuff for dogs or cats
Or nothing at all.
or nothing at all. But I think because it's flavored and they think of it as a treat, I think you should use it. But and technically you don't have to do that at all. Now I would like to address strategic teeth as well, if I may.
Please.
So in dogs and cats, speaking about brushing teeth and taking care of them and me doing my job, there are 8 what we call strategic teeth. It is the 4 fangs or canine teeth and then 4 chewing teeth. Those are the teeth we jump through massive hoops to save. If we can save, we want to save them all. The other ones are negotiable, though. These are not. We jump through hoops to save those. We do root canals, we do crowns, we'll do things for periodontoses like guided tissue regeneration, all kinds of cool stuff and fun stuff to try to save those teeth. And we can't always do it, but most part we do it. Root canal therapy in dogs, I know it sounds funny. People say, I didn't even know you could do that. Oh, well, of course we can. Where do you think the human did this learn it? They learned it from us. Root canal therapy has a 96% published success rate. Why in the heck would you want to take that tooth out? I mean, that's just crazy.
So people are going to be going, well, why does it matter? Why do they need those strategic teeth? So you might want to.
Good question. So let's talk about the 4 chewing teeth. If I take out, let's say, one of the chewing teeth on the upper left, okay, right here, and that dog can live to his genetic potential and have a good life. However, it's going to shift all this chewing of kibble to the other side. So guess what? We don't get really any cleaning action over here. So when I see these dogs come in, their teeth are going to be really dirty over here. And if you don't clean them frequently, that leads to periodontal disease and tooth loss. Over here, because we're doing all the chewing over here, we get excessive wearing. So that is why. Now the fangs, obviously, the mandibular canines, the ones on the bottom, they kind of hold the tongue in, right? I hate taking those out because these little dogs, their tongue hangs out, and they're cute, and we still love them, but we'd rather keep the tongue in their mouth. This canine tooth here, it is 1 millimeter from the passageways of the nose, so it's a lot better to keep that tooth in. It just is, and it also gives her face form. That answer your question?
Yeah. Cool. Oh, that's perfect. That's perfect. Okay.
Dr.
So,
Wingo, I had a question. I'm sorry to interrupt.
Yeah, please.
So would you want to start toothbrushing with a brand new puppy to get them to start the routine at the youngest age possible so that they don't know anything other than teeth brushing? Or how would you approach that when they have their puppy teeth, or when and where would you start?
That's a very, very good question. I think on our website, we have a blog and a video about how to do that. But you should start the day you get your puppy. And typically what you'll do is just let them put some of the toothpaste on your finger and let them lick it and taste it. So let them get familiar with it. You may do that for a day or two. So what we're going to do is train this puppy to accept this. And you do need to start as a puppy. Many times if you start try to brush an adult dog's teeth, they're not going to allow it because it's just so foreign to them. So a puppy licks toothpaste, he likes it, okay? Do that for a couple of days. The next thing you do, put some toothpaste on your finger, just rub it around on their gums. And they lick it, they like it, right? Oh gosh, I'm getting a little treat, a little gum massage. The next thing you may do is they have these little finger cots with little bitty bristles. You may put some on that, and for a couple of days, just gently rub around their gums. And then you're going to graduate to a very like pediatric toothbrush, very, very soft bristles. And then you're going to put a little toothpaste on that, and the puppy's all ready, he's happy, and you brush. I'm going to say the majority of puppies learn this easily. It is slow and being persistent and being patient. You know, their attention span is kind of like the human male. It's not very long. So you do a little bit and you let them go for a little while, okay? And then the next day you do the same. You do each stage a few times, a few days, and then you graduate to the next. I even have one of my residence mates, a guy named Don Lawton, brilliant guy. He had this cat. I've had this video of this. He's brushing his cat's teeth. He started his kitten like that, and this cat lays in his lap, and he brushes his teeth for about 2 minutes. So it can
awesome.
be done with cats. It's a little trickier with cats. I think cats are kind of like mules. It takes a few more repetitions, but then they don't cheat you as much. As long as you know you don't get all bloody trying to teach them. But it can be done. And yeah, with dogs, you just got to take your time, and that's where the toothpaste comes in handy because most of them are food motivated. They like getting their treats. They like the attention. I had one client that had 3 Australian Shepherds, and she brushed her teeth at a certain time every night, and they'd line up. They wanted their teeth brushed because she taught them, and they have a routine, and they had wonderful teeth. I think one of them broke a tooth, but the rest of them were good.
Yeah, I got to start. I got to get better at that because I have
Don't
a puppy.
we all?
I have
Yes.
a puppy. I got to get better. So tell us about, for people like me who have maybe been a little lazy about doing this, what are the consequences of as dogs age not taking care of their teeth?
Well, I think that this is, I don't know if this is opinion and it's not published fact, but me and most of my colleagues, you know, we get together where we're having our adult beverage. All we talk about is what we do. I have a text message group of me and 5 other my buddies that are dentists, oil surgeons like me. Today I've had 43 texts from them. So this is what we live and breathe. You're talking about nerds. We're real nerds. Now football season, they get a little crazy with that too. But we all believe, and I believe this is fact, that the largest cause for a dog being old is dental disease. And the reason we all believe that, because we remove this source of inflammation and pain from these dogs. You don't know they're in pain. They're not telling you. They're still wagging their tail and eating. You know, did you know that a dog can break all his teeth out and it's going to wag his tail and eat? They're not going to tell you about that. They feel the same sensations we do. They just don't whine like we do. So the reason that me and all of my colleagues, or most of my colleagues, believe that dental disease is the largest cause of a dog being old because we repair their mouth, we remove the pain, we remove the inflammation, that they're younger. They act better. And I see it over and over and over again. Matter of fact, I hear it so much. If on my follow-ups I don't hear it, then I'm thinking, dang, did I miss something? You know, because it's just so common. People tell me every day, I've got a younger dog. I've got my cat zooming again. It's just crazy. So I don't know if there's a scientific link of cognitive dysfunction in animals related to dental disease. Empirically, or based on my experience, I believe there is strong evidence of it. One thing that and maybe Dr. Fossum, she's way smarter than I am, could comment on. We have a source of inflammation when we have periodontal disease in pets. That inflammation can't be doing you any good. You know, in the past, we thought maybe it can be a complication of heart disease, liver disease, kidney disease. It certainly is in people. And a lot of this evidence we use hadn't been done in people, in animals yet, but it's done for people, and we carry it over. It's pretty much the same physiology.
So there's no doubt that inflammation is associated with aging. And there actually is a paper out. Curtis Dewey wrote it. So he's a veterinary neurologist. Actually, he's a double-boarded veterinary neurologist, veterinary surgeon. And he did a small study looking at the relationship of periodontal disease and canine cognitive dysfunction and showed a correlation. So it is out there.
Excellent.
Yeah. So bottom line is take care of your dog's teeth when they're younger and as they age, and they will age better and they will likely live longer. So that's, I think, really important.
May I address for our audience what dogs can and should not chew on?
Oh, please. Yeah, that's great.
Okay. There are 4 things that we see dogs that get to chew on that help make my mortgage. That would be bully sticks, cow hooves, antlers, and nyla bones. Those break teeth. They do horrible things to their mouth. So please, guys, if you're, I know the dogs love them, they do, and they say, "What am I going to give them?" You shouldn't give them that, or I'm going to get in your hip pocket, and I do, because the dog's suffering with this big abscess when they break their teeth. So when you buy your toothpaste, us humans, typically there is a seal of approval from the American Dental Association, ADA, on your toothpaste, right? We veterinarians have a similar organization called the Veterinary Oral Health Council, VOHC. So VOHC issues a seal of approval for products for dogs and cats to help their oral hygiene. In order and manufacturers want this because it helps them sell their product, right? In order for that manufacturer to get that seal of approval, they have to submit valid research. And the time you get in our position, you've read so much of that stuff, you can tell what's valid or not. There's a committee of board certified veterinary dentists, oral surgeons that are evaluating this. So valid research. The research has to demonstrate 2 things. If fed appropriately, right product to right animal, it probably won't do harm, not like the other 4 things I mentioned. And the other thing they have to document, it has to do some good. Let's quantify good. Again, if brushing teeth is that good, all this stuff is about that good. Okay, so it does help. I give my dog some stuff every day, and
You're talking the dental chews.
Dog foods, washes, rinses. They're all useful, but they're not as good as brushing teeth. It's just easier. I give my personal dog, my Labrador, she's sweet. She only has 2 brain cells. They don't communicate well, but she's so sweet. I give her a chew every day, and I don't know if it helps her. 3 minutes later, it's gone. She wants another one, so I give her another one. So one can go to that website, vohc.org, and there's tons of manufacturers. There's tons of products on there. That's what I recommend for chews or home care. Anything, just buy at your cheapest source. It doesn't matter where you get it.
Okay, I'm going to relate my personal experience. So I have a 4-year-old Labrador, and I won't name the company, but there are those boxes that you can get, and they have ones for super chewers. So I thought I was doing this great thing by getting my 4-year-old Labrador a super chewer box. Well, he ended up having to have dental care because those really hard things that they chew on will break their teeth. And that's what it did to my dog. I actually even let this company know that I thought they shouldn't be selling these super chewer products, and they pretty much just laughed at me, but it's a problem. I had my own personal experience. And I did get chewed out.
No pun intended.
Nicely, but I did. I got educated, they'll say, which is appropriate.
Kind of a funny story. Several years ago, I had a young lady that was a law student, and she was feeding one of those products. I told her, just what I told you guys. But darn, she was all fit to sue somebody, so she had them pay the bill. I don't know how she pulled that off.
Wow.
Yeah.
Wow.
My son and I were at Costco 2 or 3 years ago. They had a big display of some of those products. I asked my boy, I said, "Do you see that?" He said, "Yes, sir, I see that. That's how we can afford to be here." I'm telling you, don't give them those things. And I hear over and over, but they love them. What else am I? give them to chew on. You're going to break their teeth. Not if, it's when.
Good to know. Really good to know. So we all need to be more careful. So I would just like to add that Sean and I published this book this year called Senior Dogs, Maximizing Time with Your Best Friend. And one of the chapters is dental disease. And my friend here provided the photos and much of the information. So I want to thank you for that. Tell us about dental disease in senior dogs.
It's a big problem. The issue I see with dental disease in senior dogs is people get this notion in their head that my dog is too old to clean their teeth. And understand that because that dog or cat won't sit in a chair and keep their mouth open, they have to have general anesthesia. Okay, they just do. And there's risk in general anesthesia. Heck, there's risk in driving to the store, right? The risk of anesthesia and oral cleaning their teeth is less than not doing it. Okay, so you actually have more risk statistically if you don't clean their teeth. So consequently, what I see is the older patient. Let's talk about a Labrador. Average age, I think, is about 13.2 years these days. When I started, it was a lot younger than that, so we're doing a better job. My owners are doing better, and so are veterinarians. So dog's 10, and people say he's too old to clean their teeth, and some of my colleagues may tell them that, and that's just wrong, because then they come to me when they're 13, and they've got what I call potty mouth. I mean, they're just sick. They've got pus in their mouth. They have horrible halitosis, and they don't feel good. And I mentioned earlier that dogs feel the same sensations we do. That's a scientific fact. What they don't do is complain like we do. The most wimpy creature on the face of the earth is the human male. If I had the potty mouth like in some of these geriatric animals that I see, I would be in intensive care begging for opioids. And they're wagging their tail, and they're still eating. They may be eating differently. They'll nearly always eat with dental disease. So don't think having a broken tooth or even an abscessed tooth will make them quit eating. It's rare to happen, but they'll eat differently sometimes. And the very astute owner may pick up, say, oh, yeah, he's eating differently. And maybe he prefers a different food, or he quit eating his kibble. He wants it all soft. And that's when the dog is training the owner. So we can absolutely help our older dogs and cats live longer and have a better quality of life by taking care of their teeth, of their oral health. Keeping them clean. Home care is the most important. Second most important is the things that we do. So, and again, let's talk about why people are afraid to do that. Typically, it's general anesthesia. That tends to be the rate limiting step in what we do. But I can tell you that general anesthesia has advanced tremendously in my years of practice. It's just a whole different world. And in my practice, me and my buddies that are on this text message list I mentioned, we hired an anesthesiologist. And he just works for us exclusively. There's about 10 of us that hired this guy. So every one of our patients, he reviews their history, their medical records. He makes a custom protocol. We have these fancy, what they call life window anesthetic monitors, and he's seeing those real time. We're in constant contact with him with every patient, and he does amazing things. We just really, anything can happen, but it's just very, very uncommon to have complications of anesthesia. It just is. And for you people listening, please don't let that be a reason to not have your dog's teeth cleaned and adequately looked at. And one thing too I want to mention about that, there are many good general practitioners in the United States and Europe too that can do a good job cleaning teeth. But things I want you to ask when you go: are you going to x-ray all the teeth? If they don't say yes, then you need to go somewhere else, okay? It is the standard of care today that every time these pets get their teeth clean, we don't call it a prophy, but every time they get their teeth clean, they have to have full mouth X-rays. So when we look at the crown of the tooth, the part above the gum line, that's only about a third of the tooth. 2/3 of the tooth's under the gum line. So I had a lab 6 weeks ago, had 2 little bitty chips that looked fine, but little bitty chips on these teeth, and got my imaging done, had these honking abscesses, and we do CAT scans on all of ours, and you can see where these abscesses were eating through the bone on the side of this dog's face. And to look at the teeth, oh, they've got a little nothing chip there. So always, always ask, are you going to take x-rays of my dog or my cat's teeth? And the answer should only be yes. It should not be an option. It should not be an extra charge. It should come with a deal. And if not, think them and go somewhere else that does. And a lot of general practitioners are very good at that. We, in our practice, routinely anesthetize old dogs, old cats. And I'm going to tell you, 50% of them eat that night. The rest of them eat the next day. It's very, very uncommon to have complications from that. So don't let that scare you. Specialists are really good at anesthesia on tricky cases. Many, many general practitioners are very good because we do it every day, all day. We continually study and try to get better. So don't let that be a deterrent to you. So that's the biggest thing I see with older patients is people just say, "Hey, just too old to do that."
And you know what? What we always say is age is not a
It is
disease.
not.
Dental disease is a disease. Age is not.
Yes. And you know, a lot of these dogs, these people are saying, well, he's X amount of years old. And I'm calculating the dog's age in people terms, he's my age. You know, I'm not ready to give up yet. I don't want to have oral pain in my mouth all the time. So, yeah.
So I had a question actually for you. Similar to humans, you go every 6 months. How often should a pet owner should be taking their dog to go see and get their teeth cleaned from a veterinary, a professional teeth cleaning?
It's a good question. I like to get most of my patients in by a year of age. So when they're a year old, I want to radiograph, X-ray all these teeth, and have a good look at them. Most dogs, bigger dogs, we clean roughly every year, and that there are exceptions to that. And when I say clean, it's not just cleaning. We call it a comprehensive oral health exam and treatment. So if we do this every year, that's the equivalent of every 5 to 7 years on you, right?
Mm-hmm.
So we're cutting corners on some of these. Some of them have to have it more. So even on a large breed dog, a larger breed dog, some of those patients, I'm going to say I want to see every 6 months. So start them at roughly a year, okay? And then on smaller breeds, I mentioned Yorkshire Terriers. I love Yorkshire Terriers.
They're little dogs who think they're big dogs.
Yes, they're tough little dudes. So those dogs about the size of a bread box, most of those dogs need the cleaning every 6 months. If you want to keep, and they outlive these big dogs, right? They just do. You can really enhance the quality of their life by doing it. So every 6 months, you get in, take care of whatever you need to do. And, you know, when we're cleaning teeth, everybody's doing labs first, so you can identify other issues too while you're there. So it's just a good thing. Does that answer your question?
For sure. The next part of that would be, you know, can you classify breeds or dog size into specific categories? I know you just mentioned a specific breed that you have to change every 6 months. Is that because of the size of the dog and because it lives longer, or is that just because of it's a specific breed?
Well, it's because of the specific breed, and what we have done, mankind had done, is focused on color and size, phenotype of these animals. So we've bred that, and we haven't really looked at the health of their mouth. So, and it's funny, we shrink the size of these dogs, but guess what? Their teeth don't shrink in proportion. So
Oh wow.
many of these small breed dogs, the size of a bread basket, if you will, their teeth are huge. They're crowded, and when they're crowded, they have plaque build up between them. There's a genetic component, obviously, as well. That they just don't have as good teeth. And then, for example, like Dr. Fossum and I both have labs. They have this huge mouth. Their teeth are nice and spaced apart. We get less problems. Typically with the larger dogs, because they're rambunctious, and I'm a lab guy, but they're not rocket science, right? So they injure themselves a lot. Typically on larger breeds, we're treating lots of fractured teeth. A few caries, cavities, if you will. But, we talked about caries earlier, and that's a real common thing in people. So the way caries work is we have some carbohydrated sugar on the surface of our teeth, and a bacteria eats up the sugar, and its byproduct is acid. It dissolves and makes a hole in our teeth. Well, we don't see that frequently in dogs. Every year I'll see about maybe a half dozen or a dozen. We always get really excited, show the residents, oh, look at this. They're fun to restore. I love doing that. But I had a friend in Poland. It was a
Sorry.
dog treating once.
Sorry. Matt just got one.
So I had a friend in Poland that moved to a new place, and she saw tons of caries in her practice. She just moved there, and she couldn't figure out what happened. So she did. So there was a local bakery selling dog treats that had sugar in them, and the whole town was buying them. So she actually went on TV and said, "No, I can't feed these treats." And she said she saw 0 caries after that. So it really hurt her business. She did her job very well.
Caries, cavities, same thing?
Yeah, sorry. Yeah.
No, just making sure, being new.
I forget. So with breed disposition, smaller dogs inherently have worse teeth. They just do. Larger dogs have less incidence of periodontal disease. So let's define periodontal disease, because that's a term we throw out there a lot, and I don't think a lot of people know. So the periodontum is the supporting structures of the teeth. Okay, it's the bone, the gum, a thing called the periodontal ligament, another thing called cementum. And when you lose the supporting structures of the tooth, obviously you lose the tooth, right? So we see periodontal disease primarily in the smaller dogs, and we see some in larger dogs. But in larger dogs, because they're boneheads, they run into things, blah blah blah, and they break their teeth or break their jaw, and we fix those. In these little dogs, I really can't overemphasize brushing. If you can do that, you can really help these guys. If you get a Yorkie, I used to tell people in general practice that they'd bring me a Yorkie puppy in. Oh, they're dang good dogs. Actually, I may get one. I'm really considering it. But they get these little Yorkies. I said, you don't need to save money to send this dog to college, because he's probably not going to go to the Ivy League college. But you better start saving for the dentistry that this dog's going to need. And we would tell them that all the time. We get a chuckle, and 2 years later, say, "Oh, you were right. I wish I'd have brushed the teeth." So those are the biggest thing. We do see, excuse me, specific problems in certain breeds. Boxers have a thing very common called genital hyperplasia, overgrowth of gum. We'll see that frequently in those dogs. These little sidehounds, they'll get some autoimmune problems in their mouth more frequently than others. So just as in humans, there are groups of people with specific problems, is the same in veterinary medicine.
Kipp, you want to talk about
Excuse me.
tumors in the oral cavity? I know I've operated a bunch of them, and it's not one of my favorite surgeries, because we usually have to remove bone, which means removing part of the jaw, or maybe the front part of the mandible, or even some of the maxilla, depending on where the tumor is. You want to talk about?
Yes, ma'am. I do a lot of that. And I said earlier that roughly 25% of my practice was oral surgery for cancer. I don't know. I think right now in the last 10 months of this practice, it's more than that. I haven't counted the case numbers, but every week I see multiple patients with oral tumors. So it depends on what the tumor is. And yes, it is my job to physically remove that from the animal. Okay. It depends. The prognosis, the outcome is dependent primarily on what the cancer is. So typically we get a sample first, we send it off. The pathologist tells us what we're dealing with. The most common, generally thought, is a tumor called melanoma. People get that too, the skin tumor in dogs. It occurs in the mouth frequently. There is some controversy if it's the most common. I published a paper in 2018 looking at 403 cases of oral tumors. In my estimation, squamous cell, at least in the Phoenix Valley, is the most common. We documented that. So with melanoma, it's bad like it is in people. We do a lot of surgery on those. With those animals, first we'll want to do a metastasis check. Metastasis check is where we're imaging the rest of the body, looking for where the tumor has moved to other organs. And typically, if that is negative, there's no evidence, that then we'll go to surgery, but only then for like melanoma. And typically, when we're removing any oral tumor, we look at the tumor and we want to get clean margins around that. It's either 10 to 20 millimeters, depending on obviously the size of the dog and what kind of cancer it is. Melanomas are not good. Not that they can't live a long time. They can. You have to be aggressive, and you have to be very early in your diagnosis and treatment. And a lot of times you don't know. Other tumors, like bone tumors in the mouth, we see those quite a bit. I just had one of those last week. In the legs and arms of dogs, it's really not a good thing at all. In the mouth, it's pretty darn treatable. If I can physically remove that, then a lot of these dogs can have a pretty good life. Squamous cell carcinoma is the most common human tumor in the mouth, and in cats too. In cats, it's an awful disease. In humans, I don't want it. I'll tell you, you don't want that. In dogs, pretty darn treatable. If I can cut that out, I can treat them. We see probably about half of the oil, maybe 40% of the oil masses I see are benign tumors of dental tissue origin. Benign, let's define that, meaning they don't spread to other, are unlikely to spread to other parts of their body. However, they can be locally aggressive and act like Pac-Man and really destroy whatever's there. So now we've talked about different types of cancers and treatment. And now we didn't really talk about treatment, but I want to be specific. Dr. Fossum mentioned that, you have to remove some bone and teeth, and we do. And it sounds horrible. It is not horrible. There is one paper published. They looked at 90 cases of dogs that had these, I'm not going to say radical, they're pretty routine for us. I do them every week. That have had these surgeries, and the owners, 96% of them are glad they did it, and they would do it again. My clients, I have had 6 clients in the last 15 months. So here's my name and number. If anybody's doubting this, have them call me. It sounds awful. It does. I have owners pick up their pets and cry when they leave, but then they tell me, hey, I'll be a witness for you on this. So it works. Last week, Dr. Schomburg and I did a really extensive dog, had bone cancer. We took out his whole jaw. It's a very difficult procedure. It's 5 hours and 18 minutes of surgery. Dog ate that night. Go figure, right? And one of the things, it is very invasive. I'm trying to tell you guys that if you have this, it's not the end of the world. We can help a lot of these patients. And just because they're missing a few teeth and maybe some of their bone, they can have a wonderful, wonderful life. Not in every case, but in many, many cases.
And they don't spend any time looking in the mirror, so they aren't
They
going to
don't
be
care.
upset. They don't care.
They're not humans. They're not vain.
No. And the other thing I would just want to throw out there is this is the value of going in every 6 months, because Dr. Wingo mentioned melanomas. Well, you would think melanoma would be pigmented, but there are non-pigmented melanomas. So you might see a growth in your dog's mouth and think, oh, it's not a big deal, it's pink, and it could be a melanoma. And the earlier, it's like every other tumor, like you guys hear all the time, the earlier we identify them, the earlier we diagnose them and we start treatment, the better the success is. So, See, having your dog seen its mouth checked, because I know it's hard to see inside your dog's mouth sometimes. Having it checked by a dentist every 6 months is going to give you a leg up. You're going to get an earlier diagnosis, and your dog is probably going to live longer.
So, kind of along the same lines, I had a professor in Texas A&M named Mike Willard, probably one of the best veterinarians in the world.
Love Mike.
Yes, and he taught us you haven't done a physical exam unless you've looked in the mouth. Okay, you haven't. And I teach my residents that, and I try to teach my general practitioners that if you're a veterinarian, and most of them will, doesn't open your doggy's mouth. I mean, as long as your dog's not trying to bite their fingers off or something, right? As long as your dog will allow that. If they're not looking in their mouth, you probably need to ask them about that. Say, would you mind looking at those teeth? Okay. So it's just so important. And a good veterinarian may say, oh, there's a lump there. Let's go see Dr. Wingo. Okay. Let's get a sample of that now, and then we'll go see Dr. Wingo. So it's just really important.
So we're going to wind up, but I want you to tell everybody, so that people live in the Phoenix area, the name of your practice and location, because they might want to come see you.
Well, I hope you do. So my place is Carefree Dentistry and Oral Surgery for Animals. We're at the intersection of the 17, they say around here, in Carefree Highway. We have 4 doctors. Me and Dr. Schomburger are specialists. We have a lady named Dr. Jucan that is sitting for boards now. God bless her. She's stressed ball. And at first of the year, we put on a resident. And if you guys want to come visit, we would love to give you the nickel tour. We're very proud of what we have. One of the things we do that is cool because it's fun and I can see so much more is everybody gets a CAT scan. It doesn't cost any more. Just because it's fun, I can see so much and it can plan so much better. They still get the intraoral x-rays as well. But it's a cool place. We've got a good practice, and I have the best team in the world. My support staff, oh my gosh, I've been working with some of these people 10, 12 years. They're just amazing people. Amazing. And we'd love for you guys to come by and say hi.
Awesome.
Before we kick off, and Dr. Wingo, thank you so much for your time and sharing. I personally am learning so much, and which is why I have 2 more questions.
Yes, sir.
Can you walk through like hard food versus soft food for dogs?
Oh, yes.
And
okay.
What are your thoughts there?
So my thoughts are that hard food actually helps keep their teeth a little cleaner. So it's a moot point if you're brushing, right? Especially if you're brushing twice a day. There are even dental diets out there. Most of those dental diets have the VOHC seal of approval. They are helpful as well. Remember, nothing replaces brushing teeth. You just can't. But they are helpful. On all of my patients, if they're able, I try to get them to eat hard food. Is it the deal breaker if they don't? No. But I just think it's better. Kitty cats, I think their natural diet would be soft if they're eating mice, maybe a few bones in there. Kitty cats, maybe they get a little moisture with a soft too, but if you can brush their teeth fine, just get their teeth cleaned regularly by your veterinarian. So yeah, I think dry is better for the oral hygiene, for the good oral hygiene. If you're brushing, it's a moot point. And all you guys consider the dental diets. I'm a believer in them. They help. They do.
Awesome. And one more question. I've seen some advertisements for this non-sedating teeth cleaning and so forth. I just wanted your general thoughts about that.
I think it is probably one of the worst things we can do for our pets. And this is why. This brown, goopy, hard stuff we call calculus or tartar on the crown of the tooth that you see smells awful, looks horrible. But you know what? It causes no harm to the health of the tooth or the systemic health of the dog. All of the disease occurs right under the gum line. There's a little furrow there we call the gingival sulcus. It is absolutely impossible to clean under that gum line in a conscious patient. You just can't do that. So I equate to non-anesthetic dental cleaning as a grooming. They look better and smell better, but have you really helped their health? One of the reasons that I am really against that is because frequently patients are referred to me sometimes by these people doing these procedures. It's ironic. And I'm taking, if not all their teeth, a lot of their teeth out due to end-stage periodontal disease that is painful, it's poisoning their body. So the reason I think that I think that this non-anesthetic dental cleaning is worse than doing nothing because it creates a false sense of security. People think, yeah, I'm getting my dog's teeth cleaned and I'm not having to do anesthesia because it really stresses me, and I get that. It stresses me sometimes too. But you're not doing your dog any good. You are not. I think, personally, I think it's malpractice for a veterinarian to do that or endorse that.
Understood.
Because
Wow.
I can just think of right now in my mind 5 or 6 people just crying because I'm showing them the X-rays of this dog's mouth, and we're looking at that, and they say, "I thought I was helping my dog." You're not helping your dog. It's just wrong to do. Now, if you understand what you're getting into, yeah, they're gonna look better and smell better. That's fine. If you're good with your dog's teeth rotting out of his head, that's fine. If you understand that, it's not my dog. I'm not a. I don't endorse that. I don't think you should do that. It was actually, oh gosh, 10 or 12 years ago, the Association of Veterinary boards met, and we tried to make it not an acceptable procedure, but the theory at the time was, well, people have free will; they can choose what they want. It's the wrong thing to do. I'm here to tell you. And another thing along the same lines, well, I get my dog's teeth brushed every 2 weeks when he goes to the groomer. Waste of time. Remember, if you're not brushing these teeth every other day, you're just wasting your time. So, no, don't do that. And in my opinion, in the opinion of the 216 board certified veterinarians in North America, board certified dentists, well, are all going to tell you no, it's the wrong thing to do. And you know what? I had a client one time tell me, he said, well, you just want all the work. No, I don't. Because if there is more non-anesthetic dental cleaning, I'm going to get to do more surgery, right? I'm going to be taking a lot more teeth out. This is about doing the right thing. If people are utilizing their veterinarians to clean these teeth properly, I'm going to do less work. It's about doing the right thing. Just don't do it. Don't do it. I have a whole lecture on that. PowerPoint, the whole deal, if you want sometime.
That's super helpful. I'm glad I asked the question. And I know Terry has mentioned that in the past as well, that she's against it. So and so it was very good to hear your exact perspective as well. But I wanted the audience to hear that as well, because I think it's super important. Well, this has been great, Dr. Wingo. Thank you so much for your time, and thank you for joining.
It's been my pleasure.